join, and then we'll get started. So again, welcome everybody. Thank you for joining us. You have tuned in to today's webinar for the Robert Wood Johnson Foundation Systems for Action Research Program in our 2024 Call for Proposals. The agenda that you see before us is how we'll use our time today over the next hour. I will spend some time giving an overview of the Robert Wood Johnson Foundation Systems for Action program, and then talk specifically about the details of the 2024 Call for Proposals. We'll discuss the focus areas and the attributes of research studies to be funded under this 2024 call. We'll also then talk about some of the details and mechanics about how to apply and how the application and review process will run. We will save some time toward the end of our hour today for Q&A. And so I want to encourage people who have questions that you'd like to ask to use the Q&A icon, which you should see down at the bottom of your Zoom screen. You can tap on that icon and then type in your question, and you can do that anytime during today's webinar, and we'll get to as many of those questions as we can today. If there are questions that we don't get to before the end of today's hour, we will continue to answer questions and post those questions on our website and email out updates to everyone who've registered for today's webinar. A few other housekeeping details about the webinar. We are recording this session today. We will post the recording of today's webinar along with the slides that we use on our Systems for Action webpage at the link that you see here. And we'll also email that link out to everybody who's registered for today's webinar. Everybody who's with us as an attendee in this webinar, because we have a large group, several hundred folks, everybody will be muted, so you won't be able to vocalize during this webinar. That's why if you want to ask a question, we ask you to use the Q&A box down at the lower portion of your screen. Type your question in, and we'll get to as many of those as we can today, and post any questions we don't get to. We'll post the answers on our website and send those out to registrants as well. So again, welcome. I want to first introduce some of the key people involved in the Robert Wood Johnson Foundation Systems for Action Research Program. At the top of your screen, you see the program officers for this program at the Robert Wood Johnson Foundation, including Carolyn Miller, Senior Program Officer, Isabel Cuervo, Program Officer, and Leah Carey, another Program Officer, all with the Research Evaluation and Learning Division of Robert Wood Johnson Foundation. We are so fortunate to have very strong and capable leadership for this program. We have these program officers with us today at the webinar. Some of them may help us answer some of the questions today as we get into the Q&A portion. We also have a very talented group of people at the National Program Office for the Systems for Action program, which is based here at the University of Colorado. And I'm one of those people. I serve as the director of the National Program Office, Glen Mays, also a professor here at the University of Colorado. And you can see a number of our other key staff at the NPO listed on the slide as well, most of whom are also with us today and will help us manage today's webinar and help us answer questions during the Q&A portion. So a little bit more about the S4A program. This is a signature research program of the Robert Wood Johnson Foundation. It was launched back in 2015, one of a number of signature research programs designed to build evidence and conduct research to inform the Robert Wood Johnson Foundation's Culture of Health action framework and agenda for building a culture of health across American communities. The real touchstone of the Systems for Action research program is shown on this slide, and that we are dedicated to supporting research to help us identify ways of helping to align medical, social, and public health delivery and financing systems, help to align the actions and the strategies of those different delivery and financing systems in ways that can improve health and well-being, and particularly in ways that can advance health equity and reduce inequities across population groups. We have a research agenda that we encourage you to access and reflect on. That can be accessed through our Systems for Action webpage. You can also find information about the previous and ongoing research studies that are currently funded through the Systems for Action program, which can be helpful to get a better sense of the types of studies that we fund and support, and what it means to align medical, social, and public health systems, what some of the strategies that we're currently studying for aligning those systems are. So I encourage you to take a look at that work, and all of that work is documented on the Systems for Action website. That brings us to the topic for today, which is the 2024 call for proposals. Systems for Action has released a call for proposals about annually over its 7-year history. This most recent call for proposals we released on December 13th, which we're very excited about. I encourage everybody to take a look at this funding opportunity, in particular to download the funding opportunity brochure, which you'll find on the landing page for the Systems for Action program on the RWJF website. Also, that link is listed here at the bottom of this slide. And you can see that the focus for the 2024 call for proposals is consistent with our larger research mission of studying ways to help medical, social, and public health systems align their work, align their efforts toward the goal of advancing health equity. But in this 2024 call, we have a specific focus on dismantling and disrupting the health effects of systemic racism. So our focus again for this 2024 call is to focus on studying strategies that can disrupt and dismantle the health effects of systemic racism that operate through medical, social, and public health systems. So that's an important, very important aspect of understanding on this call, that overarching focus on solutions to systemic racism that operate through medical, social, and public health systems. So in particular, we're looking for applicants who can identify an innovative strategy for aligning medical, social, and public health systems, and aligning activities specifically to disrupt and dismantle forms of systemic racism, especially forms of systemic racism that operate through those medical, social, and public health systems. We refer to the innovative strategy for system alignment that applicants will propose as the alignment strategy. You'll see that language used in the CFP. We're looking for studies that propose an innovative alignment strategy and propose to test that alignment strategy and to conduct research on that alignment strategy. This year's 2024 call for proposals actually has two different types of awards that you can apply for, that you see are listed here at the middle of the slide. The first category of award is a developmental study. These are designed to fund smaller scale studies that are kind of earlier in the research process, that are designed to support preliminary research, to support pilot testing and feasibility testing of an alignment strategy that applicants will propose. There's a second category of award that you can apply for that we call the Impact Study Award category. This is a larger, somewhat longer term award that is designed to support studies that will estimate the impact and the effectiveness of the alignment strategy in disrupting health effects related to systemic racism. So two categories of award: a smaller scale developmental study and a larger study impact award that applicants will have the option of selecting which of those two opportunities fit best with your research idea. all of the studies that we fund through this call for proposals are also designed and expected to support robust research translation activities that are designed to help relevant community partners use the results of the study, the resulting scientific knowledge, to actually align systems and to address the effects of systemic racism beyond the study settings that are involved in the study. And that's another hallmark of our Systems for Action research program. As a for-action research program, we place a lot of emphasis on community engagement and research translation activities designed to move evidence into action and to help community partners use that evidence to actually act in aligning systems to improve health and health equity. As you read further into the call for proposals opportunity and the funding opportunity brochure, you will see there are three special topics that are of particular interest in this 2024 call for proposals. And those are summarized in the funding opportunity brochure on pages 2 and 3. And we encourage you to read that brochure carefully. I'll just briefly summarize each of these three special topics of interest right now. Topic number 1 is studies that are designed to help us better understand forms of systemic racism that are embedded in medical, social, and public health systems. So these are studies that will that are really designed to improve our understanding about specific forms of systemic racism that operate within or that affect medical, social, and public health systems, and studies that are designed to fill important gaps in our current scientific knowledge about those forms of racism, how they operate, and very importantly, how we might proceed in designing interventions to disrupt those forms of racism. So studies that are proposed in under this special topic, number 1, again, should focus on specific forms of systemic racism where the body of existing scientific evidence is insufficient to help us develop strategies for disrupting them. If you're applying under this special topic, you want to make sure that your application is identifying important gaps in scientific knowledge and describing how your proposed study will address those gaps, and then indicate how your proposed new research will help to inform the development of new system alignment strategies that can address those particular forms of systemic racism. We ask that applicants who are applying under the special topic number 1 to make sure that your proposal addresses the 3 key components that are shown at the bottom of this slide. Number 1, how your study will elucidate or identify how forms of systemic racism operate and persist within and across medical, social, and public health systems. Number 2, quantifying the impact of those forms of racism on the health and well-being of affected populations. And number 3, your study should explore potential pathways and opportunities for dismantling and disrupting those forms of racism and their adverse health effects through system alignment strategies to help medical, social, public health systems align their efforts. So that's topic number 1. And again, more information about that topic is available in the funding opportunity brochure. The second special topic of interest that is described in this year's CFP relates to studies that are designed to help us address resource inequities across systems. One of the major barriers to medical, social, and public health systems working together and aligning their activities is that these systems often have highly inequitable resources, and that can prevent or at least inhibit collaboration and integration and coordination of activities. So for studies, applicants that are applying for studies to address this topic number 2, your application should be designed to evaluate novel strategies for more equitably allocating and sharing resources across medical, social, and public health systems in order to better support collaborative solutions to systemic racism. We're especially interested in studies that focus on forms of systemic racism that make it difficult for minority communities, minority-serving institutions, and historically marginalized communities to secure equitable resources, funding, staffing, and other resources that they need to meet community needs and tackle forms of systemic racism. So we're especially interested in studies that can address those inequities and resources that affect minority communities, minority serving institutions, and other historically marginalized communities that experience forms of systemic racism. Studies in this category might test novel financing mechanisms that are designed to more equitably distribute resources across systems. They might test novel payment models or staffing models or other types of resource sharing models, again, that can help medical, social, and public health systems work together, share resources equitably to address forms of systemic racism. And then finally, studies in this category might also decide to try to tackle within their study solutions to what we call wrong pocket problems. And the S4A program has studied these kind of problems, wrong pocket problems in several of our earlier CFPs. And basically, wrong pocket problems are problems that arise when the costs and the benefits of collaborative work are distributed unevenly to the different partners in that work, particularly partners that operate in medical, social, and public health systems. So as part of this special topic number 2, we're also interested in, again, studies that can test solutions to wrong pocket problems that result in unequitable distribution of costs and benefits across these different systems. And again, more information about the special topic number 2 can be found in the funding opportunity brochure on pages 2 and 3. Next, let me describe the third special topic of interest that you will see in the CFP. And this topic relates to studies that are designed to strengthen the voice and authority of marginalized communities in system alignment strategies. So for applicants who are interested in proposing a study under this topic area, number 3, these applications should propose studies that are designed to evaluate strategies for strengthening the voice and the influence of marginalized and racialized communities in determining how medical, social, and public health systems operate, how they work together to address forms of systemic racism. So we're interested here in, again, studies to test ways of giving marginalized communities, racialized communities, greater voice, authority, influence in medical, social, and public health systems, and in the work of those systems to address systemic racism. So as part of this, we're interested in studies that might test novel governance models and decision-making mechanisms that are designed to give greater voice and authority to marginalized communities, like looking at novel approaches to governing board representation and authority, novel community deliberation and decision-making structures and mechanisms, like participatory budgeting strategies, for example. Studies might investigate novel approaches to public reporting and public disclosure requirements as a way to empower communities to have greater influence over medical, social, and public health system activities, and any other innovative approaches that you may you may come up with in terms of how to strengthen community oversight, community influence, community accountability across medical, social, and public health systems. For this special topic of interest, and really for all of our studies under the CFP, but especially for this topic, we're very interested in studies that will include a focus on engaging people with lived experience related to systemic racism in the kinds of solutions, system alignment solutions that are being developed and tested under this call for proposals. So again, more information about this special topic number 3 you can find described in the funding opportunity brochure on pages 2 and 3 of that brochure. So these are 3 special topics of interest. You are also welcome to propose studies that are related to other topics, unrelated to these 3 topics of interest, as long as your proposal fits with the overarching focus of the CFP on testing system alignment solutions that involve medical, social, and public health systems, and that are designed to help those systems work together, align their efforts to dismantle and disrupt forms of systemic racism. So you can propose other studies on other topics unrelated to these 3 special topics of interest, as long as they fit with the overarching focus of this CFP. Just a few more insights about what what we're looking for, what the Robert Wood Johnson Foundation is looking for in terms of successful proposals under this 2024 call for proposals. Again, number one, we're looking for studies that are proposing to test alignment strategies that engage all three of the sectors that are the focus of the S4A program. That's the medical care sector, the public health sector, and the social services sector. So that's very important. And the alignment strategy you're proposing to test needs to involve representatives from each of those three types of systems: medical care, public health, and social services. We do have more detailed definitions of how our program conceptualizes and thinks about each of those three types of sectors and systems. And that can be found in the Systems for Action FAQ page on our website, and that's linked to here on this slide, and we'll also have links later on in the slide deck to our FAQ page. So we encourage you to take a look at, in particular, about how the S4A program defines medical care systems, public health systems, and social service systems for the purposes of the CFP. And we do use really quite broad and inclusive definitions of these sectors and systems in this call. Secondly, successful proposals will be able to articulate a clear and convincing logic model describing how the proposed alignment strategy will address health equity problems, and specifically how the alignment strategy will address the forms of systemic racism that is targeted in your proposal. So we want to see a clear logic model or theory of action for how your proposed alignment strategy will actually work. If successful, how will it work to dismantle or disrupt forms of systemic racism and how they operate across medical, social, and public health systems? Number three, successful proposals will articulate a rigorous and clearly specified scientific research approach for testing the system alignment strategy, testing either its feasibility, if it's a developmental award, or testing the impact and the effectiveness of that strategy if you're applying for the impact award category. So thinking about key elements of your research approach in terms of the research design, data sources, measures, and analytic methods. We are a research program, and so we do value strong scientific research approaches that are used to answer these kinds of questions. Fourth, successful proposals should have a focus on measuring and achieving system-level change, helping medical, social, and public health systems align their efforts at the system level, working together to dismantle forms of systemic racism. So proposals that have a narrow focus on looking at impact at just an individual patient level, for example, or an individual person level or family level, but are not designed to look at system level impact, system level change, are less likely to be successful under the CFP, given our focus on systems and aligning systems. The fifth point here, successful proposals will demonstrate a clear commitment to prioritizing community-initiated and community-engaged study approaches. We feel that the really innovative and promising solutions to system alignment problems and the most promising solutions to systemic racism are likely to come from communities that have experience with these forms of systemic racism, and communities that have experience in working with medical, social, and public health systems. So we are very interested in proposals that, again, are proposing solutions that have been developed through community-initiated and in community-engaged approaches, strategies that incorporate individuals with knowledge of the communities that experience forms of systemic racism, and people with expertise in approaches for dismantling and disrupting those forms of systemic racism. So community engagement, really, really important in the CFP. And then finally, as I mentioned, we are a 4-action research program, so we're place a lot of emphasis on funding projects that have strong strategies for helping others use the evidence, use the research produced by the study to take action around aligning systems toward the goal of dismantling systemic racism. So we're looking for applications that can have strong, clear strategies for disseminating results and helping stakeholders take action based on those research results to align systems and dismantle racism. As I mentioned, there are two categories of awards, and again, these are described in more detail in the funding opportunity brochure, so please take a careful look at that. The first category award are for developmental studies. These are for early stage research studies. These awards will provide up to $100,000 in total funding to be used over a period of up to 12 months to conduct the project. And it's designed to support preliminary research, to support pilot testing and feasibility testing of the proposed system alignment approach. So earlier scale pilot testing, feasibility testing, preliminary research. The foundation anticipates funding up to 5 studies in that developmental award category. The second category is the impact studies category. These are somewhat larger awards. Successful applicants will receive up to $500,000 in total funding to be used over a period of up to 36 months or 3 years to conduct a study designed to estimate the impact of the effectiveness of the proposed system alignment strategy in dismantling and disrupting the health effects of the forms of systemic racism that are the focus for the study. So this is a larger award category. The foundation anticipates funding up to 4 studies under this category of award. Very, very importantly, if applicants who want to apply for this impact studies category, you will need to, in order to be eligible for this category, you will need to be able to provide documentation that you've already conducted some preliminary research on the proposed system alignment strategy that you want to test. So you already have pilot test results that demonstrate the feasibility and the acceptability of the approach that you propose to use. So that is a requirement if you want to apply for the impact studies category. You've got to already have these preliminary research results or pilot test results that you can describe in your application. If you haven't done that preliminary research and pilot test study yet, that's okay. It just means you need to be applying for the developmental award, developmental studies category. Another important thing to note is that, again, as a research program, we anticipate that successful applicants will use the funding through this application primarily to support research activities that are proposed, rather than to support the implementation cost of the proposed system alignment strategy. So that's something to keep in mind. If you're looking for funding to help implement your proposed alignment strategy, this particular funding opportunity is not the best source of that kind of support. So if you're needing to use funds to actually implement, that will mean there will be fewer resources available to support the research activities to actually evaluate the system alignment strategy, and that is the major focus of this call. And so important to note on that. There's more information about that issue you can find in our frequently asked questions or FAQ webpage for this opportunity. A couple of key resources just to point out. There are links shown on this slide, and again, you can access these links in the slide deck that it will be available on our website after today's webinar. One is the call for proposals landing page on the Robert Wood Johnson Foundation website. Very important that you access that landing page, review the material that's available on that landing page. It provides really important information about this opportunity and how to apply for it. One of those really important resources is the full 11-page funding opportunity brochure that's linked here on the second bullet point. Really important that everybody download that and read it. Again, it has a lot more detail about this opportunity, about the special topics of interest, about the requirements, eligibility requirements, and the aspects of your proposal that you'll want to include. So make sure you review that full 11-page funding opportunity brochure. Third, we have as I mentioned earlier, an FAQ page that you want to make sure that you've reviewed. That is available on our Systems for Action website under frequently asked questions. So encourage you to take a look at that. Again, really helpful information is found there. We also are updating that FAQ page on an ongoing basis as we receive more questions from you all, potential applicants. And so encourage you to keep an eye on that page, and you can note as it's updated and note the updated information there. Number 4 key resources is as we'll be talking about, there's a 2-stage application process, starting with a letter of intent that will be due on February 7th. There is a very important letter of intent template that you will want to make sure you download and use as part of your process of developing your letter of intent that will be due on February 7th. That LOI template, there's 2 templates actually, one for the development award category, one for the impact award category. That template tells you exactly what kind of information you want to include in that 3-page letter of intent. It has very specific guidance on what to include. It outlines the 4 different headings you want to make sure to use and what information you make sure you want to include under those 3 headings. So really important to download that template, take a look at that additional information and guidance and instructions as you develop your LOI. And then a few other resources shown at the bottom of the slide. As I mentioned, our larger S4A Research Agenda is available on the website. And you can find descriptions of previously funded and currently funded S4A research studies that have been funded through previous CFP opportunities. And so we encourage you to take a look at that family of now more than 40 studies that we funded so far under the S4A program to get a better sense of what kind of system alignment strategies are being studied by existing projects. A few other CFP resources related specifically to this opportunity. One is I want to make sure you know that we, in addition to this webinar, we every week hold an open office hour session where you can drop in and feel free to ask any other questions that you have about the CFP and seek any other guidance that may be helpful to you as you're thinking about an application and developing your application for this CFP. So more information about our weekly office hour sessions, again, are available on the Systems for Action website. There is a really brief registration process. You need to register if you want to participate in one of our office hours, and you can do that from the Systems for Action webpage. Secondly, I want to make sure that our community-based organizations know that there are some additional resources that are available to you, additional technical assistance opportunities and supports that are available to you through the System Alignment Innovation Hub. This is a relatively new component of the S4A program that started up last year. And we make available specifically to community-based and practice-based organizations to help non-research organizations essentially develop your ideas for system alignment, prepare them ultimately for research testing. So we encourage those of you who work for a community-based or practice-based organization to get to know our System Alignment Innovation Hub at the link here. And there are a variety of technical assistance and guidance opportunities that can be helpful to you. Again, these resources are designed specifically for community-based organizations, not for university or research institutions. So important to keep in mind. And I've given you the link to the System Alignment Innovation Hub as well as the email address for the System Alignment Innovation Hub for those of you who may want to take advantage of that resource. My only caveat would be in taking advantage of those technical assistance resources, don't wait to the last minute to do that. There may be limited ability to provide technical assistance in the days right before the CFP deadlines, in particular the deadline of February 7th for the letter of intent. So please reach out early to our colleagues at the System Alignment Innovation Hub if you'd like to tap into their technical assistance and support for community-based and practice-based organizations. And we definitely encourage you to do that. Just a few more details about the funding opportunity and specifically about how to apply for this opportunity. Again, encourage everybody to read that full funding opportunity brochure that's available on the Robert Wood Johnson Foundation webpage. And you will see a link to the full call for proposals brochure on that landing page for the Robert Wood Johnson Foundation. So Make sure you get to that landing page, click on that link for the full call for proposals brochure, and make sure you have that downloaded. Also of note, in that opportunity brochure, some of the details described there are the selection criteria that we will use, and the foundation will use for selecting applications to fund under the CFP. There are 6 of those selection criteria that are articulated on pages 10 and 11 of the funding opportunity brochure. You see a couple of those shown here: the focus on systemic racism, the innovative system alignment approach, and there are a total of 6 criteria. Definitely make sure that you read through those so you'll know, what the foundation will be using to, what criteria the foundation will be using to review applications and ultimately select applications for funding. Third, as I mentioned, the first stage in the application process is the submission of a letter of intent, a 3-page letter of intent. We do on February 7th. You want to make sure that you download that letter of intent template because it provides very useful additional instructions about what information to include in your 3-page LOI and about specifically how to format your LOI in terms of the nitty-gritty details of the font size and the line spacing and the 4 headings that you need to make sure that you include. So these LOI templates are available on the Systems for Action website. They're also available on the RWGF website on the application and review submission system that you'll use for submitting your application. And again, there are 2 different LOI templates, one for the developmental studies category, one for the impact studies category. And again, as I mentioned, this template has very detailed instructions about exactly what to include in your LOI. The LOI is limited to 3 pages only, so you've got to be really judicious in what information to include. So you want to follow these instructions pretty carefully. And we try to be very clear about what information we need to see in that LOI to give your application the fullest possible consideration. A brief note about eligibility. Our eligibility criteria have been consistent throughout the history of the Systems for Action program. Applicants, organizations that are eligible to apply for this funding opportunity need to be public entities or nonprofit organizations that are tax exempt under the 501c3 section of the IRS federal tax code. The organization needs to be based in one of the 50 states or DC or one of the U.S. territories. We definitely encourage multi-organizational collaboratives and consortia to apply, but you need to have one of those organizations selected as the single applicant organization, and that applicant organization needs to make sure it meets these eligibility criteria of being public or nonprofit based in the U.S. or a U.S. territory. The application process, as I mentioned, it's a 2-stage process we're using. The first stage or first phase of the application is submitting a brief 3-page letter of intent. That letter of intent or LOI is due on or before February 7th at 3 p.m. Eastern Time. This is a required letter of intent. You need to submit electronically through the RWGF online application review system. Again, use that LOI template for further guidance on what information to include in your 3 pages. You will be limited to a maximum of 3 pages. So make sure you use that template. Deadline again for the LOI, February 7th at 3 p.m. Eastern Time. Please submit early so you don't run into problems, website problems, connectivity problems, leading up to that deadline. After that deadline, we will review letters of intent and identify a smaller group of applicants to invite to submit a full proposal. And we expect to issue those invitations to submit full proposals to selected applicants on or about March 25th, 2024. And that will bring us into the second phase of the application process, where the invited applicants will develop a full proposal narrative of up to 10 pages, along with a proposal budget and a budget narrative and some additional application materials, and we'll submit those full application materials on or before the deadline of May 22nd, 2024 at 3 p.m. Eastern Time. So that will be the second stage, is submission of full proposals by May 22nd. The full proposal application materials, again, will include a proposal narrative of up to 10 pages. It will include a budget that follows the budget guidelines of RWJF, and it will include a budget narrative that describes in more detail key elements of your budget. And it will also include some additional supporting documents, including CVs or bio sketches for key personnel, a timeline of the proposed activities. It will include required letters of support from collaborating organizations. And if you're applying for the impact award category, you will also need to submit your pilot test results or preliminary research results as part of that application process. That all needs to go in on or before May 22nd. Those full proposals will then be reviewed through our process, and funding decisions will be made by the foundation, and the foundation will notify funded applicants during the period of leading up to the grant start dates that should be on or about September 15th, 2024. So again, important to remember, this is a two-stage application process, starting with just a brief 3-page letter of intent, but that is required to be considered for funding. So February 7th is the first very important deadline of submitting that brief 3-page letter of intent. One more time, reminders on important dates. February 7th, 2024 is the deadline for submitting your 3-page letter of intent through the RWJF online application review system. 3 p.m. Eastern time on that date. Again, we encourage you to submit early. Don't wait to the last minute, because website problems and connectivity problems often tend to crop up just when you least expect them and least can afford to deal with them. So please try to submit early. We anticipate notifying applicants who will be invited to submit full proposals on or about March 25th. The full proposal materials will be due on May 22nd, also at 3 p.m. Eastern time, for the applicants who are invited to submit full proposals. And then we anticipate that the applications that are funded for this CFP will have grant start dates on or about September 15th, 2024. Okay, I know that was a lot of information, but we do now have about 15 minutes left for questions. And so again, we encourage folks to use the Q&A box that you'll see down at the lower part of your screen, that Q&A icon. Click on that and you can type in your question. We'll get to as many of these as we can during the next 15 minutes. If we do not get to your question during today's session, we will be posting written responses to these questions as well on our website, and also emailing those out to everybody who's registered for today's session. One question I see is that somebody has completed some preliminary studies, but these were not funded by RWJF. Can you use the results from non-RWJF studies as your preliminary studies or pilot test studies in applying for an impact award? The answer is yes, absolutely. If you're applying for an impact award and you're going to use preliminary research or pilot test studies, it doesn't matter who funded that preliminary research. That work may have been funded by RWJF. It may have been funded by a federal source, another foundation, a state or local funding source. We are agnostic to who funded your preliminary research or pilot studies work. Next question. Question about, in the future, will the S3 program continue to offer these two categories of awards, the developmental studies, the impact studies? It's hard to know exactly what we'll do in the future. We try to be a learning program and to learn as we go about what mechanisms work best for producing actionable evidence. I will say that this is the second time that we've offered these two categories of awards. We offered these same two categories in last year's 2023 call for proposals. We I think we're successful in getting in getting both strong applications in both categories. So that's why we've retained this element in the 2024 call for proposals. We'll continue to kind of monitor how this pans out and how the different categories of awards work in making decisions about future directions for the program. But for now, we are definitely have the two categories of award available for your consideration in this 2024 CFP. Next question. Do we consider policy interventions or policy implementation as an alignment strategy that you may propose for testing under this this call? I would say the short answer is yes. You may look at policy forms of policy implementation or using policy to help align the work of medical, social, and public health systems. That certainly could be a viable approach for designing a novel system alignment strategy to help medical, social, and public health systems align their work. So short answer would be yes, absolutely. System alignment strategies that use policy as part or all of the mechanism for aligning systems may very much be appropriate for this this program. I will note that we do have a sister research program at the Robert Johnson Foundation called Policies for Action that is specifically focused on studying policy design and implementation as a way of addressing health and health equity. So for those of you who are interested in policy-oriented strategies for system alignment, you may also want to keep tabs on the Policies for Action program and what they're doing and their opportunities as well. But certainly policy-related system alignment strategies would very much be relevant under this call for proposals. Next question. We have a question asking that we do ask you to identify what particular medical, social, and public health systems or programs you plan to work with as part of the application process. This question asks, is work within and between university departments seen as sufficient for this application? So work that would seek to align university departments of social work and university departments of nursing and university departments of public health or medical school departments as sufficient. That's an interesting question. I would say, I would say it depends. Again, in S4A, we're really focused on helping delivery and financing systems align in this work. Delivery and financing systems that operate in medical, social, and public health systems. And so I think to the extent that your academic departments are actually functioning as delivery and financing systems for medical care, public health, and social services, then potentially that an alignment approach that focuses on those academic departments could be a fit here. But I think I would encourage you to think carefully about whether what you're studying, the units of alignment that you're studying, really are delivery and finance systems, really are delivering and or financing services in the community, and you're looking to align those activities. Certainly there are academic medical centers that operate hospitals and clinics and deliver medical care, and there may be academic departments that deliver social services and housing. In my experience, a lot of times those academic departments can be playing more of a much more limited role in the actual delivery and financing of services in the community. So you want to think carefully about that, and also think about what impact you would have in the community if you were only focusing on kind of academic or university based units and resources. So just encourage you to think carefully about that. And again, encourage you to look back at our frequently asked questions, how we define medical, social, public health systems, how we define delivery systems and financing systems, and think about how that might apply to the actors and the activities you're proposing to align through your project. Very good. Next, I'm going to take a drink here just for a second. Question asking does our program anticipate another CFP of the same kind at a later date for those who are not able to develop a proposal within the current timeline? Good question. I will say that our program has been on a schedule of releasing call for proposals, research opportunities approximately annually. And so that has been our kind of historical way of operating. So I would say it's likely that we will continue to have future funding opportunities released, next year and in subsequent years. Always that's subject to decision making at the foundation and the subject to the availability of resources and strategies and priorities of the Robert Johnson Foundation. But that for the S4A program, we have been operating on a cycle of releasing funding opportunities on an approximately an annual cycle. And so we do anticipate having future funding opportunities being released in future years, including for applicants who apply for developmental awards and hope to be able to apply for larger impact awards in future years. That is the kind of a logic that's built into the program. But of course, that's subject to availability of resources and decision making at the Robert Wood Johnson Foundation. Next question, we have a question asking about the perspective for impact studies. Do the programs and interventions need to be designed to disrupt structural racism in systems? Do they need to have already shown empirically to be feasible and efficacious before testing impact in a new setting? I would say the first part of that is true. If you're applying for an impact award, you need to have preliminary research that shows that provides support that the alignment approach you're proposing is feasible. We're looking for evidence that implementation is going to be feasible. You've tested the implementation of this strategy to some extent, and you can demonstrate that through preliminary research, previous research, pilot testing. We don't require that you already have evidence of efficacy or effectiveness, because that's the purpose of the impact award funding. We want to fund studies that are designed to produce evidence about efficacy, effectiveness, about impact on populations that experience systemic racism. So you do need to have evidence about feasibility of implementation. You don't need to have already evidence about efficacy or effectiveness in order to be eligible to apply for the impact award. Very good question. Next question asks, can the problem study be a global problem? Good question. We do get questions about this. The focus of Systems for Action is producing evidence that can help us solve health problems and problems of systemic racism here in the U.S. that affect American communities and that affect populations here in the U.S. that experience systemic racism. So that's the overarching goal of S4A programs: producing evidence that will be actionable here in the American context for populations that experience systemic racism here in the U.S. That being said, there may be opportunities for taking lessons from other contexts, from global contexts. I would say as long as you are including U.S. settings in your study, and the study is designed to produce evidence for actionability within the U.S., I think you would be in scope for this S4A program. We recognize that some of the forms of systemic racism that we are challenged with here in the U.S. and that we want to seek to disrupt are not unique to the U.S., but also operate in other international contexts. But on the other hand, we know that many forms of systemic racism have a very important historical context, and can be path dependent in terms of understanding how they've developed here in the U.S. can be very, very important to be able to address them. So just want to make sure that you understand that the intent here of S4A is to produce evidence that is actionable for settings here in the U.S. and including U.S. territories. And also remember that in terms of eligibility, the applicant organization needs to be based in the U.S. or in one of the U.S. territories. Got time for a few more questions. Question about special topic number 3. We're seeking research to evaluate the effectiveness of these strategies, not in the creation of a project that uses one or more strategies. Is that right? I would say the answer there is it depends. If you are applying for an impact award under special topic number 3, then yes, we would expect you to be proposing to evaluate the effectiveness of a strategy under topic number 3 if you're applying for an impact award. However, you could instead apply for a developmental award under special topic number 3. In that case, for a developmental award, we would expect that you would be proposing to test the feasibility and the acceptability of an approach that was responsive to special topic number 3, consistent with the developmental award category. So with that caveat, just keep in mind, under each of these special topics, you might apply for a developmental award, or you might decide you are positioned well to apply for an impact award. So just want to keep that in mind and give that careful consideration. Question asking about urban agriculture. Project involves increasing minority urban farmers that increase their financial independence, decrease barriers, healthy food areas. Would that be relevant? That absolutely could be very relevant for S4A. Urban agricultural activities would fit broadly under our definition of social and community services and delivery systems for social and community services. So that could be one of the systems that you seek to align under a proposal under this CFP, along with medical and public health services. So depending kind of on how you define those units, but certainly system alignment projects that involve engaging with agriculture, farming, food systems, economic development in urban and rural farming systems, for example, those certainly could be very, very relevant systems, especially operating in the social and community services sector as we define it broadly.
While you're on the topic of funding here, Glenn, I want to highlight a few other questions in the chat. So people are wondering if there needs to be a budget for the LOI. There is also a question about nonprofits utilizing a fiduciary for qualifying and disbursement of funding, if that's okay. And I think you can see a question right on the bottom of the screen here.
Yeah, those are good questions. I would say definitely take a look at our FAQs, because those are also covered in our FAQs. So yeah, quickly, at the LOI stage, you do not need to submit a budget. All you need to submit is a 3-page letter of intent, along with answers to some other questions that you'll see as part of the A&R system. It's only applicants that are invited to the full proposal stage. That's the stage where you will develop and submit a full budget along with a budget narrative. And the question about a fiduciary or a fiscal sponsor, yes, the foundation has a standard process for organizations that will benefit from having a fiscal sponsor be the applicant organization that is a eligible model. And you can contact us if you have questions or more information about that. There are also answers about more details about that on the Robert Wood Johnson Foundation's funding page about use of fiscal sponsors. And with that, we are at the top of the hour, so I will need to bring us to a close. If we didn't get to your question today, we will be emailing out answers to other questions we haven't gotten to today. And also encourage you to keep an eye on our FAQ page because that will be updated continuously as we go forward in the process. Thank you so much for joining us today. Thank you for your interest in this program and this opportunity. We look forward to hearing from you. Thanks so much, everybody.